Hi, hello. So, another aspect of addiction is high functioning addiction, where people are actually functioning at quite a high level in either their jobs or their careers, keeping all the balls up in the air, but they're still in the throes of addiction, like gambling or drug abuse or alcoholism. And in a way, it can be very covert because they're apparently functioning very normally, keeping their jobs, turning up for work on time, completing their work, but there could be some things, some cracks that are occurring, and maybe some slip-ups at work, and maybe suddenly one day just not turning up or falling ill and calling in sick a little bit more often than usual, and it becomes a bit of a slippery slope. But for the most part, people in this situation are actually functioning, as it's called, high functioning addicts. But it's still something it's impacting negatively on that person's life, usually impacting negatively on their finances. Perhaps anxiety, depression levels are very high. Trust levels between work colleagues or family relations and friends may be sort of falling apart or kind of cracking at the seams a little bit. So there are issues there. It's one of those addictions that, like I say, seems to be on the outside. The person is functioning very well, but actually they're like a swan, sort of seemingly gliding along the surface, but underneath they're just paddling like crazy to keep afloat. And often people in this situation find it extremely difficult to actually seek help. They find it very difficult to identify that there is actually a problem, because for the most part those balls are being kept in the air, even though they might be falling every so often. And it can be a difficult one. If you're watching this and you're one of those people, then maybe you might identify that there's an issue. If you feel you want to talk to somebody or talk to myself, I have worked in the legal profession in the past, so I understand the stresses and strains that happen in that area, and people can easily fall into addiction due to the basic stresses of that type of work. And it happens a lot in professions, and it can be difficult to get out of, because people are, they've just got huge stresses in their jobs. They need to keep their jobs and keep their clients happy, keep patients happy if they're in the medical field, and it's quite complex. But like any other person that I'm advising to seek help, reach out, get some support, I'd be very happy to talk to you as well. So that's the end of my clip for this evening. It's another beautiful evening here. I'm just taking advantage of these lovely evenings for now. So have a good evening. Bye for now.